President Joe Biden's recent diagnosis with prostate cancer has men thinking more about this. Here to tell us more is Dr. Roberto Navarette, a board-certified fellowship-trained urologist with AtlantiCare. Thanks for joining me. What do men need to know about prostate and prostate cancer?
Basic tenets of prostate cancer to know are that it's a malignancy that starts in the prostate gland. It's typically a slow-growing cancer, and many men are found to have it, and it never needs to be treated in any way, shape, or form, but it's important to initiate prostate cancer screening based on guidelines. So starting at around age 50, or if at higher risk, starting around age 40 to 45. And there's a number of different things that put you at risk. Primarily, it's age is the biggest risk factor. So most diagnoses start around age 50. If you have a common family history, a first-degree relative with prostate cancer, and there's a number of different lifestyle influences, high-fat diet, obesity, and smoking that can contribute to its development. And then if you have it, contribute to the life thereafter.
Well, that contributes to so many different issues. And what are some of the testing available? And do you find men are getting better at doing this? Men often don't go to the doctor as often as they should.
Typically, surveillance is with a PSA blood test. So it's a yearly annual blood test that you get pretty much from age 50 to about age 70 based on standard guidelines right now. And it's a protein that's produced both by prostate gland and by cancerous cells. It's a great screening test. It's sensitive, but it's not very specific. There's a number of different things that can elevate PSA. So that's why it's important to get started early with screening and continue to kind of establish a baseline and make sure that we don't kind of lose track of something, that we're able to find out whether there might be a malignancy underlying that rise in that PSA value. We also do digital rectal exams. Those are kind of falling out of favor as of late. There's a few organizations in the UK that are arguing that those digital rectal exams are not as effective for prostate cancer, cause unnecessary anxiety and discomfort. So there is some wiggle room, but I'd say at least getting the annual prostate cancer screening with a PSA blood test.
And are men doing better with it?
I'd say they're doing better with it. I think, and a large part of it stems from, as you mentioned, just the recent slate of news, the diagnoses, and notable figures. I think it's important to keep everyone, as an advocate of their own health, to be aware of the things that are important for their own, their own lifestyle and their own health.
Absolutely, so very important. Thank you so much for joining me, board certified urologist with AtlantiCare, Dr. Roberto Navarette. And you are living well with Robin Stoloff.